Welcome to Becoming Limitless. Today, we are entering one of the most debated and promising frontiers of modern medicine, regenerative therapeutics. I'm joined by the great Dr. Adeel Khan, founder of Eterna Health and a physician working at the cutting edge of stem cells, exosomes, secretome therapy, and cellular optimization. His work is bringing next generation regenerative protocols to the UAE and the wider region, working with high profile individuals, athletes, and those seeking not just treatment, but biological renewal. In a region that values performance, aesthetics, and longevity, regenerative medicine is becoming part of the conversation. But the real question is not whether it works. The real question is who is it for, how it should be used, and whether it is a shortcut or a strategic tool. Today we unpack stem cells, Muse cells, exosomes, accessibility, ethics, and the future of biological renewal in the Middle East. Welcome, Dr. Khan.
Yeah, thanks for having me.
So happy to have you.
Yes.
Yeah, this is a long time coming.
Yeah, no, I just came here a year or so ago, but it's been a great move because they're so supportive of this type of medicine.
Yeah, and I've seen the journey. I've met you when you first came, and
yes.
and the things that happened since then, and the growth, and all of that. And I'm really happy for you and for the region.
Yeah.
I think it's really important to have someone like you in the region.
Yes, I think having that authenticity and being able to focus on the science and not just the commercialization
100%.
is very important.
I agree, and this is where you and I actually jive, and we kind of speak the same language.
Yeah.
I guess we can jump right into it, and one of the things that I'd love to hear for myself and for anyone who's listening or watching this is that what are they exactly? What are exosomes? What are stem cells? Just give us like an overview for in layman terms for someone to understand what they are.
Yeah, so I think first we have to define regenerative medicine, right? So people understand what is regenerative medicine. And It's basically just we're trying to restore structure and function. Mm-hmm. So what that really means is that as disease happens and as you age, tissue breaks down, right? That basically means the cells are not functioning properly. Cells become dysfunctional. Their instructions get blurred, they make mistakes, they don't do their job as well as they used to. Mm-hmm. And so how do we make those cells function better again? Mm-hmm. And that's essentially what regenerative medicine is. It's just unlocking your body's own innate repair mechanisms. So this can be done with cells, it can be done with the right signals, it can be done with gene edits, it can be done with tissue engineering. And if you think about it fundamentally, I think a lot of people intuitively understand your body can heal, right? If you get a cut on your hand, it's going to heal on its own, right? And why can't this be done for organs as well? So it's not as simple, but it's possible. And that's where regenerative medicine is headed. And some of the tools that we have at our disposal, as you said, was stem cells, exosomes, and all these different products. And at a very simple level, the easiest way to think about a stem cell is just an undifferentiated cell, meaning that it hasn't turned into anything.
Right.
So it's just like a naked cell in your body that has the possibility of turning into anything in your body. So meaning it can actually repair tissue or do what it needs to do to replace the damaged functioning tissue. Mm-hmm. So that's one possibility of what stem cells can do. And then they have their signals. Their signals are basically the exosomes. Okay. Think of them like text messages or I like they're little bubbles that basically communicate between cells. Mm-hmm. And those exosomes are actually really interesting because they're not just therapeutic, they're diagnostic as well. Okay. So meaning that what happens as you get certain chronic diseases and as you age, you start getting altered intercellular communication. Mm-hmm. That's one of the hallmarks of aging.
Of course.
And so basically these text messages, and exosomes are one of these very important text messages, get distorted. So the wrong signals start being sent. Mm-hmm. So if we can send you the right signals, it can kind of reprogram the cells to send the right. So if we send the right signals with the exosomes, it can reprogram the cells to also send the right signals.
I see.
Yeah.
Okay. What is the functional difference between them? So if we're talking stem cells, exosomes, secretome, what's the functional difference between them? If you kind of differentiate, how would you differentiate them?
Yeah. So a stem cell gives you the raw building blocks to actually build new tissue. Okay. Whereas exosomes are a fraction of the secretome. So the easiest way I like to explain this to people is that if you have chicken soup, the chicken, the meat part is the stem cells.
Okay.
And then the broth, the entire broth is the secretomes.
Okay.
Or conditioned media, is another term for it. And then a fraction of that is the exosomes.
Okay.
So exosomes were traditionally used because they're easier to isolate, they're cheaper, and it was kind of difficult to standardize the secretome. But now the technology's improved, so you can get exosomes or secretome. And the advantage of having the secretome is that you get the entire profile of the cell signaling. So meaning you're getting the entire soup.
I see.
Whereas the exosomes, you're getting a fraction of that soup, which can still be beneficial. So essentially think of it as you're giving text messages, which are instructions, to your cell on how to heal again. But you're not giving it the raw building blocks to create new tissue. So you're trying to unlock your body's own signaling pathways to start regeneration and healing. Kind of like PRP, like platelet-rich plasma, which probably everyone's heard of PRP at this point.
Right.
And it's the same principle, right? The platelets are sending a signal to your body to start the regenerative and healing process. Now, what dictates the efficacy of these signals is the magnitude of the growth factors and anti-inflammatory cytokines. So how strong are the signals?
Okay.
And so PRP, the signals aren't as strong as something like exosomes, and then secretome is even stronger signals. So you just think of it as like a ladder, right, of like signaling. And sometimes PRP is enough, sometimes you need something stronger, right? So it just depends on what you're doing.
Okay. And what sort of clients come to you for this sort of thing? I know that, if you have an injury, rotator cuff, knee, whatever, also people come to you for that.
Yes.
Now, for, let's say, an injury in a shoulder or knee or whatever, what would be the approach in order to help it heal quicker?
Yeah, I mean, I think this has been, I guess, our claim to fame, so to speak, because we've helped so many people that were not able to be helped by the traditional system. Because, let's give an example. Like, say if you have knee osteoarthritis, which is degeneration of the joint, your cartilage is starting to thin out. And so it's not just a wear and tear condition, right? That's what the old teaching was. Right. But now we understand it's cellular dysfunction. In fact, there's research showing that what happens is the chondrocytes, which are the cartilage cells, undergo the same hallmarks of aging that happens anywhere else in your body.
Right.
Meaning you get the mitochondrial dysfunction, you get the telomere attrition, you get the nutrient dysregulation of the signaling pathways, like all those different hallmarks, right? And so that's happening at a cellular level. So it's not just a matter of mechanically just like, replacing the joint or putting cortisone in. Why can't we just try to restore the cell back to a functional state?
Right.
And that's where regenerative medicine really shines. It's treating these degenerative conditions.
Right.
So so instead of just going, for those traditional options, which are basically steroid injections or surgery, and there's physiotherapy obviously, which can work for a lot of people, right? But for people who've tried all those things or they're trying to avoid surgery, then regenerative medicine can fill in that gap. And that's where we do our assessment, and it's very important. The assessment is very important because you have to do it individualized, right? You have to use imaging, you have to do examination, and based off their personalized assessment, then you can make a treatment plan.
What makes a good client? In what sense? What were you looking for in these assessments?
Ideally, someone where they've already tried the lifestyle stuff and they've tried optimizing everything from that perspective. So they already have a low inflammatory load in their body, so meaning their biomarkers and their blood work is normalized. They've already tried physiotherapy and tried to address the biomechanics. So those things are foundationally important before we want to consider these interventions.
Right.
And most people who are coming to us have tried those, right? They're not. We're not your first line of defense, right? You shouldn't be coming to. You don't come see us as a first line of defense. You go to a physiotherapist who understands biomechanics. You go to someone like you who understands like the functional medicine, systems biology approach. You get the soil ready, right, before you plant the seeds.
Right.
Stem cells is like planting new seeds in your body, and you don't want to do that unless the soil is prepared. So that's why it's very important to do that preparatory work ahead of time. And then one of the biggest things is also, in orthopedics at least, is biomechanics, right? Like mechanical. So like, if you have, for example, you have severe bone on bone and you have big bone spurs and you have impingement, like that's gonna require surgery. There's no amount of stem cells that's gonna fix that, right?
Right.
So you have to also be realistic and be truthful about what this can and can't do, whereas a lot of, unfortunately, stem cell clinics are just like, oh yeah, stem cells can fix that, and they just, gets a lot of marketing and hype that way.
And obviously they're not cheap, but we'll talk about that later on. So it shouldn't be your first line of defense, as you were saying.
Yes.
But it's not just degenerative situations. We're talking also about regular injuries, because you've dealt with like elite athletes, you've dealt with actors, all sorts of people, and obviously local, crowds here. So it's not just for people that have an abnormality or a degenerative situation happening in their body, but also for people that go through a traumatic injury, basically.
Yeah,
right?
exactly. So a lot of people have acute tendon injuries or even bone injuries, or have surgery, and then after surgery to help their recovery. So and it can also be for pro athletes. A lot of times it's about getting back to playing as fast as possible. Right. And that's where regenerative medicine, peptides, hyperbaric oxygen, all these things can be combined to really facilitate healing.
Yeah.
So it's not just chronic. Arguably, regenerative medicine actually works better in acute settings because, for example, some of the clinical trials done in like stroke, acute stroke, or MI or heart attacks, the results are very promising. So
amazing. Yeah, I mean, I see that's the future. This is where we need to be heading. We'll again touch on that hopefully a little bit later on. Does it help? Actually, before I talk about that, you have mentioned several times Muse cells, and I'd love to understand what they are exactly.
Yes.
Yeah.
So I always have to tell the story of.
Yeah, please do.
there's very important two stories, I guess. That first, how did I come across the Muse cells?
Yeah.
And secondly, why they're such an important discovery. So, number one, the word stem cells. I mean, that was like early 1900s. You know, there was, but the modern term of that came in 1991 by Dr. Arnold Kaplan, and that was what are called mesenchymal stem cells.
Okay.
And that was derived from bone marrow, from fat, from umbilical cord, placenta, and at the time he thought that these stem cells can turn into different types of tissue, meaning they can turn into bone, they can turn into heart, brain, liver. So in a test tube, they were able to do that to a certain degree, but then he realized later, and this wasn't until like 26 years later, in 2017, then he wrote a paper realizing that he said they're not actually true stem cells, they're what are called medicinal signaling cells.
Okay.
So meaning they're signaling molecules that can help to trigger your body's own innate healing mechanism, but they of themselves are not turning into new tissue. They're not engrafting. So that was
it's more exosomes.
It's more like exosomes, exactly. So then fundamentally, why would you introduce a risk of using a cell? Because cells have risks too, which we can talk about.
Right.
And why wouldn't you just use exosomes, which can have the same type of effect as the cells? And because ultimately that's all the cells are really doing. They're just signaling.
Right.
So then that was a very important paradigm shift, but unfortunately a lot of people didn't realize that. And then when I realized that, I was kind of like, okay, why is everyone claiming these are stem cells or not? Like literally the guy who coined the term, because every single clinic, including in Dubai, that you go to are offering MSCs for short, mesenchymal stem cells.
Right.
But that's not even literally the guy who coined that term said we need to stop calling them stem cells. Call them signaling cells. So MSC, you just keep the same acronym for simplicity's sakes, but change what it stands for.
Right.
And so they're signaling molecules, and everyone who's offering them unfortunately doesn't understand the science, and so they continue to call them stem cells.
Right.
But they are not. And so that after I realized that, then I was kind of like, okay, the future is going to be likely iPSCs. And iPSCs are induced pluripotent stem cells. They're basically Yamanaka stem cells, as the other term for it. They're reprogrammed cells. So basically,
from Japan, correct?
From Japan, yes. Yeah. So what it is you take a old cell and you're kind of pressing the reset button on them. You're using transcription factors, which are just signals that determine what genes turn on and turn off. So you're turning on certain genes, and these 4 transcription factors basically make the cell turn back into a young cell. So it's kind of cool if you think about it. Like it's almost like science fiction, right? It's like you're taking something that was old and you're making it young again. So that breakthrough was in 2006, and the Nobel Prize was given sometime around 2012 for that discovery. And everyone thought this is going to cure everything, right? Or you're going to cure humanity. And there's a lot of taxpayer money in Japan that went towards this. But unfortunately, the problem with those iPSCs is the risk of tumors or cancer. So they're pluripotent, which means they can turn into any cell in your body, but they have these risks. Yeah, exactly, good or bad. So then I thought that's the future, where people will use these iPSCs, and eventually there'll be gene editing technology to prevent uncontrolled growth and things like that. But then I found out about 2 years ago from one of my patients actually about the Muse cells. And then I was like, what's a Muse cell? And it was kind of interesting because no one had really heard about them, and no one was talking about them. And so I went to Japan. I went to go meet with the Professor Mari Dazawa, who discovered them in 2000. Well, she discovered them in 2008, but then she published about them in 2010.
Right.
So it wasn't like a super recent discovery, right? Almost 20 years old, but just no one knew about it because there's multiple political reasons, and there's probably some scientific suppression, and basically the iPSCs, which are the Japanese kind of, gold standard, right? Because they put Japan on the map for science, right? Because they got the Nobel Prize.
Of course.
So of course then all the government money and all the focus went on iPSCs, and the Muse cells, which were discovered only a couple of years after the iPSCs, were ignored for the most part. And so when I came across them, I realized, wait a minute, these cells you can get them from umbilical cord, from fat bone marrow, so they're the same source as the MSCs, but they're a rare subpopulation, which basically means they're like the super soldiers, or I like to say the Rolls Royce of the stem cell world.
Right.
So you're basically, they naturally occurring, so there's no gene editing or gene modification like the iPSCs, and then you can just isolate these and then use these as a standardized source that are pluripotent. So that's the key message.
You can use it for anything, basically. That's what pluripotent means.
Exactly. They can turn into different cell lineages. So because historically the issue with pluripotent was a risk of cancer or tumors, like with iPSCs or embryonic stem cells, right, which is from aborted fetuses. But with Muse cells, they're non-tumorigenic, literally by definition, and there's some research even suggesting that they have anti-cancerous properties.
Oh, really?
Yes. So they can, if they come in contact with the cancer cell in your body, they're not going to cause it to proliferate. They're actually going to trigger apoptosis, which is cell death. Yes. And so that's an interesting mechanism that lays a foundation that, hey, maybe we can even use Muse cells for cancer therapy down the road. That's not what's being done yet, but I think that is theoretically possible. So the point is, now you have the best of both worlds. You have a safe cell, which is defined as something that's non-tumorigenic and doesn't have the risk of cancer. And at the same time, you have a cell that's pluripotent, that can turn into different cell lineages. So it's best of both worlds. And that's what the Muse cell, and so when I came across that, her work was just not well known, and I treated some high profile people like Chris Hemsworth, I think was the first one who posted about it, and then Kim Kardashian and stuff like that. And I think after those, that got the conversation going, and then now there's a lot more interest in the Muse cells, and there's a company that is scaling the manufacturing and bringing the Muse cells to the world, so to speak. And I'm excited to hopefully see that happen, and Muse cells can potentially help millions of people. That's
amazing.
Yeah,
that's like an incredible achievement on your part to be able to bring it to the world. Like, it's incredible.
Right place, right time.
Yeah, exactly.
I feel lucky for that, and obviously, for me, it was always about how do we help the most amount of people and asking those questions, because if you think about it logically, if the Muse cells they're not a new discovery, so why wasn't anybody else talking about it? And unfortunately, I think the truth is, all these stem cell clinics were happy just making a profit. They don't really care about the best outcome or what's the best science. Right. They're just offering MSCs, and they're maximizing their profits because MSCs are pretty cheap to make, and they're charging all this money. And that's really what it came down to, right? It's just about money, and that's unfortunately the business, medicine as a business, which as a Canadian physician, I never looked at it as that, right? In Canada, healthcare is free, and even though I'm in a private sector now, I always believe that these therapies should be accessible and should be actually effective and predictable, as opposed to with the MSCs where they're inconsistent and they don't give you predictable results.
So this segues perfectly. We'll talk about affordability a little bit later on, but are results always guaranteed? If, let's say, the environment is prime, people have done all the lifestyle changes and all of that.
Yeah.
So for someone who wants to go for this sort of therapy, be it Muse, be it traditional stem cells, be it or any of them, are results usually guaranteed?
It depends on what you're talking about. So for example, longevity or cosmetics, yes. Okay. Because put it on your face, you inject it, or you put it in your hair, you're going to notice a difference, like everyone does. It's just consistently, your skin will be tighter, you'll notice your fine lines are less noticeable. With the hair, it usually requires multiple treatments, but with the hair, you'll see increased density. And then if you do the IV, which is of the Muse cells, for example, which go throughout your body, you can measure before and after, and you'll see a significant reduction in multiple organ systems in the speed of aging. So
biological age, basically.
Yes, yeah, epigenetic clocks.
Oh,
which,
nice.
As you know, aren't perfect, but they're still pretty good, right? And they've been correlated with mortality and morbidity, right? So when you are aging faster than what your biological age should be, that is a predictor that you're going to have more trouble as you get older,
right?
And you're going to potentially die sooner, right?
Yeah, it's not guaranteed, obviously, but yes, it's an indicator. It's a baseline.
Yeah, exactly. It's a good, and it's a fairly accurate baseline.
Yeah.
And these epigenetic clocks are only getting better and better, right? There's some newer technology that's.
Oh my God, yeah.
Yeah. So we do that, and then at 4 months or 4 to 6 months, you repeat it, and you can see sometimes consistently you're seeing like 10 years of biological age reversal in people who were especially aging faster. Like if you're already aging slower, it'll help maintain it. But if you're aging faster than you should be, it can reverse it even, and then you can track that over time. So we need more data, obviously, to support that. But we've published some evidence of that, and it's very interesting, obviously. So for longevity, it's gonna do something. Like and that's measurable and quantifiable. And then obviously, if you are, let's say, older, like my oldest patient is like 93, for example, and like he loves it, or they love it. There's a couple, two of them, they're both like 93, and they love it because they feel more vitality after, you know what I mean? They feel more energy, better sleep, just feeling overall younger, right? And so that gives a big quality of life improvement, especially at that age. You know, if you're in your 40s or 30s and you feel good, or I've even had people in their 20s do it.
Yeah.
And if you feel good, you may not notice a big difference with it, but it is doing something inside of your body.
Yeah.
And that's the reason I personally do it, is because I want to slow down the aging process.
Right.
And I think this is one of the best tools to do that. So for other chronic diseases.
But to be clear, sorry to interrupt, but to be clear, it also doesn't supersede lifestyle.
No,
it's not like you can smoke and drink and
and in fact, if you're doing all that stuff, stem cells aren't right for you because you're putting them in an environment that is difficult for them to do their job effectively.
Right.
And you need to get those basic foundational things done first.
Okay.
And that's where the stuff you do and the stuff, we have Dr. Mansour in our team, who's a functional genomic specialist, like using your own genetics to personalize and optimize everything. That's the whole idea, right? You want to really create that favorable environment for the cells to do. And plus, it's always like we said earlier, these treatments aren't cheap, so why would you want to put this significant investment if you haven't even done the baseline stuff, right? It's just being lazy.
I just don't want people to think that, I can do whatever I want, but then I could reverse it with that. It doesn't work that way, right?
Yes.
It's not
there
magic.
Are people looking for that.
But
that's not the way it works, and that's not the way we like to do it.
Right.
So laying nothing's going to change that stuff. Sleep and stress, exercise, nutrition, the foundational things are the foundational things, and you always got to try to optimize those.
Yeah.
So to circle back around, just basically for other chronic diseases like long COVID, fibromyalgia, autoimmune conditions, it can also be effective for this, but the issue is we don't know the dosing or how many treatments are people going to need for them to see the results they want. So sometimes you do one treatment and people literally reverse rheumatoid arthritis or lupus. We've had cases, or even MS. And other people, you do a treatment and they don't notice anything.
Right.
And then you have to do multiple treatments to see a good result. So that's where the difficulty lies, and we need more research to figure that out. But for orthopedics, like chronic pain and chronic disease, that is where we do get very consistent results with like one treatment. Very consistent meaning like 90% success rate, and it's just based off the data we've been tracking of outcome data that we have with our own registry. But that's also where I think real world registries also become very important, where you have like national registries. And imagine if you had all the clinics around the world contributing to that, right? You'd have so much real world evidence to support the use of this. And that's part of the problem with this industry, is that there's all these clinics doing these treatments, but there's no one really tracking or measuring their outcomes and publishing data.
But because different regions have different sort of oversight and different regulations and different whatever, so I think it's just being held back by the divide that is global when it comes to these things, right? Because they're generally misunderstood, or for whatever political reasons or whatever scientific reasons, and comfort levels too.
Yeah.
So it really differs quite a bit.
Yeah.
But that's interesting that specifically for cosmetics and longevity, they almost guaranteed, but for everything else it's case by case, basically. Yes. And some of these things that people look to fix, so to speak, they're not easily measurable. Like like if you're talking about MS, for example, it's how would you, maybe through how you would feel, or how you are at a particular time of a particular point in time, and versus after you do them, what happens.
Exactly.
Right.
The biggest way we've seen, at least clinically, is people are able to get off their medications and not have relapses.
Okay.
So that's how we can gauge if the treatment was actually
That's also
effective.
huge.
Which
if someone is suffering
huge,
from that,
for like
oh my God.
prednisone or biologics,
Yeah.
getting off those drugs, which just suppress your immune system, and we all know they have risks, right?
Of course.
But they're the best we have in terms of traditional medicine.
Yeah.
But now we're moving away from just suppressing your immune system to reprogramming your immune system, right? It's all about homeostasis, which is bringing things back into balance, which is essentially what these treatments are designed to do. And there's a whole protocol. It's not just as simple as stem cells, but there's a whole protocol that we can do to kind of reset your immune system.
Right, yeah. That's amazing. And I think, for the amount of suffering that people have when it comes in this sort of chronic diseases, to be able to have something as simple as that, and so sort of basically not invasive, and it has these amazing results, like it's incredible. So the future definitely looks bright when it comes to this. I want to touch a little bit on peptides and see what you think about them. Because I use them and I use them with my clients too. And obviously there is like the way they're right now in the market and how people are talking about them, it's everywhere. What are your thoughts about them in general?
I'm conflicted because there is a lack of controlled clinical trial evidence and randomized controlled trials. Like there is for some, for example, like cerebral lysin. It's a peptide for stroke and brain health. And that's been well studied in Russia. And there is evidence in Russia, especially because that's where the peptides first started, since the 70s, really. And so we just don't have access to all that evidence. So that's part of the problem. Unless you speak Russian. But for us Westerners, because there isn't a lot of that real world, there isn't a lot of that controlled clinical trial data, then you have to rely on real world evidence, which basically is like anecdotal. But at the same time, you can't ignore that completely, right? If you talk to a traditional academic doctor, or if you talk to a lot of people who are like very EBM, which is like evidence-based medicine. And I actually went to the school where EBM was coined, which is McMaster University. That's literally where, in the 1970s, that's literally where the word came from. So I understand EBM more than most doctors, because that's just, I literally went to that's where I did my residency training. So, but the problem is EBM has limitations, and one of those limitations is ignoring what's right in front of you. The analogy I always like to say is like, do you need a randomized controlled trial to prove that a parachute works? Right. Like, you're not gonna. Do you want to be in the placebo group for that? Like it doesn't make like sometimes things just work and you know they work, and so I think that's also the approach with peptides that's happened, and I don't think you can stop it now because it's just everyone's trying them. And so I think instead of saying like there isn't enough evidence, this is dangerous, I think the narrative should change to work with someone who knows what they're doing, and work with someone who knows how to source high quality peptides. So it's more about sourcing and potency and quality control and standardization, as opposed to just putting something into your body and hoping it works. And again, even with peptides are ultimately a signal, right? Like you understand, I think most people understand, they're just a signal to do a very specific task. And you have to make the cellular terrain ready as possible for that signal. That signal is not going to do what you want it to do if the terrain isn't ready for it. So that's, again, you can't ignore the foundational stuff. But people just want to try these peptides as a shortcut, and they're not thinking about first fixing the lifestyle and everything else that we talked about earlier.
And it's also about dosage. It's also about taking breaks from them. People don't realize it's
people who do them year round. I've seen some pretty bad stuff.
Oh, of course. Oh my God, it's amazing. And then obviously there are certain brands that are pushing that. They would push like you would need to take BPC like forever. It's something that's part of your regime that you do. So we just don't know. So, and I always say to people, do you pick something off the floor and put it in your mouth? Like you don't do that. Like why are you doing that with peptides? Only because you've heard this and someone told you that, and So what truly matters, as you very, very rightly said, is the quality. Someone who understands them, and it doesn't mean that if someone is a physician, they know peptides, right? So they need to be able to.
In fact, the physicians wouldn't know about peptides because there isn't RCTs and clinical guidance to give us what to do with peptides. And that's what doctors rely on. They rely on like these what are called meta-analysis and these summary of evidence and clinical guidelines on how to dictate their practice. But for peptides, that doesn't exist. So how does a doctor even know what to do with peptides? Most doctors have no idea what they're doing with peptides. And the only reason I know, and the reason a lot of people like yourself know, is because they've had to experiment, or they learned from people who've been doing it. Like the people who mentored me on peptides were doing them for 20 years. You know what I mean? They started, so I have, but they're not even doctors. They're just like health coaches or whatever, healthcare providers.
The researchers more than, I mean, some of the best people that I know, that most knowledgeable about peptides, peptides, and the same with you. Like I've received information and training from people who are awesome at this, and they're mostly researchers more than physicians. I mean, physicians are busy. They focus they follow a particular standardized approach and so on. So this is not to say that some physicians are not interested in this. There's a lot that are interested and doing the work, and there are so many courses right now about them run by some good people, not all, obviously, because it is slightly the Wild West when it comes to peptides at the moment. So the general message is that, yes, they have a good potential if the environment is well set up. The source and the dosage and the guidance are crucial for them to work well. Otherwise, you could be putting anything into your body.
Exactly. I think 2 resources to help people. One would be, there's a website called FINRIC.
Yes.
And it's basically third-party testing.
We'll add that into the caption too.
And that's a third-party company, no ties to any peptide company. I've met the founder, he's super smart, legit. Like, they are basically just testing each company and ranking them.
Right.
And you'll see on there, it's scary, because you'll see on there, for example, certain very popular companies, and they test their peptide, and their peptide has nothing, like zero.
Yes, it's
like
just
zero
backwater or something.
Nothing in there. So you have to, so at least that can give you a little bit of idea of where to order your peptides then.
Right.
And then the other thing is, there's, for teaching or learning, there's a website called Peptide University, which I affiliate myself with, and I know that they have a lot of other good practitioners.
I've used it too,
Yeah, to
But
learn.
FINRIC, what's the domain for that?
Just finric.com.
Oh, okay.
Yeah.
Right.
So you just Google FINRIC peptides and it'll come up. Yeah.
Right. There's one more now that been released by one of the doctors, also I believe from Canada, Dr. Fadi. It's hormonally, I believe, or hormonally, or something like that. It's called. So it's an AI-based, sort of pulls out papers from all over the internet on specific latest research and things like that. So it doesn't rank, but it gives you quite a bit of information about it, and I find it very useful.
Yes,
instead of,
it can give you the understanding of like the mechanisms,
yes,
which is great to understand. But I think with dosing, it has to be from practitioners who've done it, because there isn't. Like,
agreed.
Yeah.
And what is scary for me, and I'm sure that you've seen it too, is that there are all these WhatsApp groups, there are all these sort of groups in general where
Reddit forums. That's what most people use.
Yes, and I mean here it's more WhatsApp, but Reddit is too. And then all this advice is being passed on by people. For me, this does for that. It's all sorts of anecdotal information that without any prior information about the person, their background, how is their lifestyle, age, sex, etc., etc. So it's a little bit out of hand at the moment. So I think there's a lot of people that are advocating the message that you're saying, and obviously a lot of our sort of environment, or the groups that the circle that we are in, everyone kind of advocates that, generally say no until you find the right person and the right source and the right plan for them. And then work on yourself before you kind of jump into that.
Exactly.
So they're definitely not a shortcut. Definitely not a shortcut.
And in fact, I think a warning because so many people are using Ozempic, Mounjaro, or now retatrutide, right? And there's so much evidence coming out now showing that when you lose 1 pound of body weight, 2/3 is fat, but 1/3 is muscle. Which is a lot. If you lose 10 kg, and you end up losing 3 kg of muscle. You know how hard it is to put on 3 kg of muscle? Because
nearly
you train.
Impossible.
You train, and I train hard too. Putting on 3 kg of muscle as a natural lifter who doesn't do anabolics is very challenging and takes years. Can take years. So it's a serious problem too, because that's going to increase the risk of frailty down the road. So I don't even think people understand the implications of these peptides long term.
And I call it like a Catholic marriage. Once you go into any of GLP-1, you just can't get off them. The moment you get off them, you're back, and then you're back actually worse than you were before because you've already lost muscle.
Exactly.
So I always say that
reserve is worse.
100%, especially unguided. And you see people taking a ridiculous amount of NGs in their bodies per week, thinking, why would you take 8, 9, like some ridiculous number?
I know, there's some people, because the problem is it's influencers, right? And it's just like people who have no medical training. And this is why China is smart, they've regulated it now, right? They're like TikTok, and you can only speak about what domain expertise you have. If you're some like business owner who's just selling peptides, you have no medical training, no science training, you're not allowed to talk about this stuff. And that's the problem with our current social media culture.
Yeah, no, unfortunately, yeah. So it's very true. Okay, I want to touch a little bit before we wrap up. We're almost out of time. So there are two things actually. One is accessibility of all of these things, be it peptides or stem cells or Muse or all of the stuff that we talked about. Because right now they seem pretty prohibitive for most people, you know? So I think you see that yourself too. Obviously because there's, I mean, why first of all are they that's this expensive?
So the reason is the manufacturing is like car manufacturing in the early 1900s. Like it's very inefficient. Okay. There's lots of people involved, lots of steps involved, lots of quality control. Which is great to get this relatively new science standardized, right? But it's been standardized and there's a reproducible process now. And so that reproducible process has to be automated, right? And that's where AI and robotics will come in, which there's already companies in China doing that. I went to a lab in China a couple months ago and everything was done. There's just like one lab tech who they don't have to pay very much now instead of having a team of scientists doing it. Right, and so China's already doing that, and the rest of the world is going to eventually catch up.
I would think that's how the future would look like.
So then you have that innovation of manufacturing happening, and then the cost to produce these cells will go down dramatically. Right now, the cost to produce them is relatively high, but there's probably going to be a order of magnitude reduction, like a 10x reduction over the next decade, is what I expect. Similar to what happened with electric vehicles and batteries, right? To manufacture, I remember because of Tesla. What used to be $400 per kilowatt per hour, right, to produce those batteries, and now it's $100 per kilowatt per hour.
Right.
So 4x reduction is huge, right?
Of course.
And that's what's going to happen with this space as well. And in fact, it'll probably be more because the manufacturing hasn't improved at all, and there's such a big leap forward that can happen. So that's number one. That's going to allow the cost to come down. And then number two is the economies of scale. So as more demand increases, which is happening because there's such a good, I think everyone's starting to wake up to the fact that traditional medicine has a lot of gaps and regenerative medicine is poised to fill in those gaps.
Right.
And so
more.
Yes, exactly, and more. And so what's going to happen is as you have economies of scale, you have more demand, then pricing comes down, right? And part of that is determined by the predictability of success of these treatments. So if the treatments are highly successful and reproducible, then more people are going to want to do them. And that's the problem with MSCs. The reason they never became mainstream is because the results weren't very good.
Right.
Like they're just inconsistent. It works for one person, doesn't work for another. Yeah. Right? And so if you have this like 50-50 coin flip and it's $20,000, like people aren't going to want to do that. But if you have all of a sudden you have something that's like very consistent, works for the vast majority of people, and the cost comes down dramatically, then all of a sudden instead of having just the elite few doing it, then you have the regular person doing it. Right. And that's what's going to happen for sure. But with any technology, it's always like this, right? It's always expensive at the beginning, and it's always the high net worth individuals, the celebrities that start doing it, and then eventually it trickles down to the rest of society.
Right. Just for the listeners, if someone, I focus on longevity, I focus on that side of things more. If someone wants to do a treatment, do they have to do it once, twice? How often? So for example, if someone does a treatment, for a longevity kind of a direction or purpose. Does only once in their lifetime, or is it something they could repeat over and over again? And if that's the case, on average, how much does it cost for someone to do a one therapy of some cells?
So if it's just for an orthopedic condition, then one treatment for most people is sufficient. Okay. Sometimes people may need a booster shot, but the majority of people will get better with one. But for longevity, yes, it doesn't have a permanent effect. Like there's maybe some long-lasting effects from one infusion, but based off the data that I've seen, in terms of using these epigenetic clocks, it does seem like there is a return to baseline after depends on the person, but let's say like 9 months-ish average. So let's say you need to do this once a year or potentially twice a year, depending on your age, how fast you're aging. So it is something you have to consistently continue to do if you want to keep the aging process at a certain rate and slow it down. So, and those infusions can cost, depends on where you go, but
in general, like
globally.
Exactly.
So we'll just say US dollars. It can cost anywhere from $10,000 to $20,000 US dollars, and even more depending on if you need a higher dose. But that's the general.
Because you hear like the in billions, right? Like the amount of stem cells that is in the infusion, right? So
you don't need billions that's usually for exosomes,
right?
But even with stem cells, the Muse cells are at least 10 times stronger than traditional MSCs. So with MSCs, you go to a lot of clinics and they'll be like, oh yeah, we'll give you 200 million MSCs.
Okay.
And they do them IV, but what they don't tell you is that 99% of MSCs get trapped in the lungs.
Okay.
And this has been published. And 90%, 95% of these MSCs die. So most of them don't even survive.
Okay.
So you have such a tiny amount surviving and left. And in fact, the irony is that we believe that the MSCs are having a benefit anyway are the Muse cells. Because MSCs naturally have Muse cells in there, right? 1 to 2% are Muse cells. They're naturally occurring. So the benefit that you're likely getting from that infusion of 200 million is likely those 1% Muse cells.
Oh, Muse cells are there. Oh, wow.
So instead of having like 2 million Muse cells, which is what you would get from 200 million, right? We can give you 20 million or 40 million. So we don't need to go, so we can do 1/10 the dose of MSCs and achieve a much higher efficacy too, which makes it safer and potentially and will eventually make it more cost effective. Right now, Muse cells are number one, they're patented, so we have to pay a pretty expensive fee to just get them. And then number two, like we said, the manufacturing is still pretty inefficient. But as that patent gets off in the next 3 to 4 years, which is it's going to expire, and then also the innovation manufacturing happens, then the cost will go down dramatically.
Okay, awesome. All right, I think that's clear for everyone. That's really indicative because most people just don't know, is it like a one-time? Is it something I have to repeat? Like all of this is kind of very clear. That's amazing. And you've addressed also, because one of my final questions was about the future and how you see it, and I think you've addressed that in the next 10 years of what will happen. So I think overall it's super hopeful. Like I'm really hopeful about the future of regenerative medicine in general, and it is not what we see right now. It's still in its infancy.
Exactly.
There's a lot of hype around it, and people use that word very generously, and it's not really what it is. In most cases, I hope you agree that it has to do with cosmetics, and it has to do with kind of superficial sort of the outward appearance more than the actual foundational health. And again, going back to the consistent message that you've said, and I support 100%, is that the environment needs to be ready. Exactly. It's not something you jump into, be it for peptides, be it for any of the regenerative medicine, advanced technologies that you use. I think it's important that we work on our system. Yeah,
the honesty and transparency is the biggest problem right now in this field, and because regenerative medicine you can make it's lucrative. So there's people, and anytime there's money to be made, there's going to be bad actors. So I've rejected people from doing stem cells, and they're always shocked. The patient is just like, what this other clinic said I'm like, no, you need to do this first, or this is not the best solution for you. And there might be a cheaper, more cost-effective solution for you. And sometimes I've referred people for just peptides or for other lifestyle interventions, and they got better. And then they didn't even have to do stem cells. But having that type of honesty is rare, unfortunately. Yeah, that authenticity is super important. And I think this is one of the many reasons why you are such a leader in your field. Yes, I think it should be. I think that should be a standard for everyone. But unfortunately, I think just honesty is such a simple thing, but it's not readily available everywhere. Especially in health and medicine. Right? It's super important. Which is ironic to me because I feel like with health and medicine, it's like you're taking care of people's. It's one of the most privileged positions to be in. So you should be like, and people are vulnerable, right? So you should be doing your best to do what's best for the person, not just what's best for your pocket, right? And it's the foundation of everything, right? It's the foundation of their whole lives. Exactly. The things that they love to do. I feel like it's wrong, right? But it's unfortunately the industry, the world we live in. Yeah. Well, that's a great point to end on. Thank you so much. This has been amazing. Such an amazing session and such an amazing episode. I think people will benefit from this. Yes, thanks for having me. Hopefully people will learn something. Of course, I'm sure they will. Well, you guys here, you've heard it first from Dr. Khan. I hope you enjoyed this, and I will see you again in the next one.